Good morning. My name is Dr. John Lourie, and with me is Dr. Harris Silverman and Bo Martinson. And today we're going to begin a new health series discussing how important nutrition is in your overall health. Many of us think about health and disease as I feel great now, therefore I must be healthy. And what we're here to discuss is that you can really predict beforehand when somebody's going to get ill and prevent it. So we can predict and prevent diabetes, we can prevent heart disease, strokes, heart attacks, and even dementia and cancer. And so one of the key underlying causes, or what we call root causes, of these chronic diseases happens to be something called inflammation. And inflammation is when our immune system reacts to something either favorably or unfavorably. So that could be smog, that could be smoke, that could be toxic food that you eat, or healthy food that you eat. So many of us don't even realize that when we eat food, we're bringing the outside world inside our body. And how our immune system reacts to that is really fundamental in producing healthy living or actually creating disease. So I run a unique medical practice that's really primarily based on prevention. So we try to prevent the top 5 causes of disease. And if you look at the top 5, the number 1 is heart attacks, number 2 would be strokes, and behind that would be diabetes, cancer, and Alzheimer's. Cancer is actually number 2. It turns out that heart attacks and strokes are the number 1 killer of men and women. Really, 1 in 3 Americans will die of a heart attack or stroke. Diabetes is now about 1 in 5. Cancer is affecting about 450,000 lives per year. It turns out that heart attacks and strokes are totally preventable. Cancer is at least 50% preventable. And diabetes that happens as an adult, which is about 95% of diabetes, is almost totally preventable. Even things like dementia and Alzheimer's disease, which we all fear because we think we can't do anything about, it turns out that's about 70% preventable. So with me here, Dr. Silverman and Dr. Martinson have developed some products that will really help focus on that inflammation, reduce inflammation, and help keep us healthy. I'd like to start with Dr. Martinson, who's done a lot of work with omega fish oils, which have an anti-inflammatory effect on our body. So maybe you'd like to talk more about the omega fish oils.
Thank you. I'm a Norwegian. I practiced medicine in Norway for 25 years. I'm a specialist in preventive medicine and also in family medicine. And about 25 years ago, it became very evident that omega-3 is extremely important in both preventing diseases and also has a curative effect. And it really caught our attention because of that dual ability of omega-3. So what we have discovered later on is that omega-3 is extremely important for stopping chronic inflammation. And my question to you is actually, how often do you see people having chronic inflammation? Because we all need inflammation if we cut ourselves,
so
but we need to kind of finish it out.
And one of the key things I do in my practice is to measure some new advanced markers of inflammation that can really help us drill down to not just the overall environment of inflammation in your body, but actually specifically tell us if you have inflamed plaque in your vessel wall, or if you have inflamed inner lining of the vessel. And that inner layer, called endothelium, is probably the most important layer. Just like your skin, we have an inside skin inside our blood vessels. And that skin is a live tissue layer that's only 1 cell layer thick, and it's very prone to damage during times of inflammation. And it's also easy to heal in the absence of inflammation. So when I measure my patient's inflammation, I find that probably at least 2/3 have elevated inflammation. And we can specifically look at which areas of their system are inflamed and then teach them and coach them through exercise habits that they may not be doing, or encourage them to do more if they're exercising, food that they're eating correctly or incorrectly, particularly, and occasionally medications if they have extreme inflammation. But we see this quite commonly.
Very good. And you talked about heart disease. I think another thing that we are discovering more and more often now is that chronic inflammation is also a prime driver for Alzheimer's disease, joint problems, rheumatoid arthritis, MS, Parkinson,
Sure.
different types of cancers.
Many chronic diseases like lupus or psoriasis or rheumatoid arthritis or inflammatory bowel disease, we don't really consider those as having anything to do with heart disease, but they're actually primary drivers of heart disease. And experts in these fields will tell you people with psoriasis and rheumatoid arthritis and those other inflammatory diseases are at significantly higher risk and have higher rates of strokes, heart attacks, diabetes, pre-diabetes, which we'll be talking a little bit about. So inflammation is a key driver.
Very good. I would be very happy to elaborate why omega-3 and omega-3 in its full composition is either coming from breast milk, which is limited the supply for
Right.
Other than small babies, and fish. Those are the only two sources where you get them all, and I will be happy to talk about that.
So tell us a little
afterwards.
bit about the difference in the omegas, because we hear about EPA and DHA, and we know that some omegas can come from things like walnuts and flax seeds.
Right.
And just without getting too scientific, which have the best anti-inflammatory actions, and where do we get these?
Yeah. Omega-3 is a family of many different members, and as I mentioned, it's only in breast milk and fish you get all of them. And what I think is important is to realize that each molecule is not operating in a vacuum. They are operating in a balance and in synergy with the other ones. And when we get it, for example, from the old famous cod liver oil, you get this incredible symphony of different ingredients. Inside the family of the omega-3 molecules, you have the longest one is called DHA, which is very important for the brain and the brain functioning. Then you have another, a little bit shorter one that is called DPA that seems to be working as a kind of signal light and regulating how much you are going to have of the different omega-3s in your blood. And then you have a little bit shorter one that's called EPA that seems to be important for chronic inflammation. And then the shortest one is called ALA, and that is the type you typically find in flaxseed and vegetable sources. But again, I think what is important to understand is that none of these molecules operate by themselves. You want them all, and the body will take care of the rest.
I think that's a very important point, especially when people look for one vitamin or one nutrient that's been placed in a capsule and expect miracles to happen. It's much more important to get all the ingredients. It's a very complex process that our body breaks down food into the individual building blocks and then puts them back together.
And that is why every study shows eating, for example, salmon, fresh wild salmon is more beneficial than taking fish oil capsules, because lots of people don't realize that the typical fish oil capsule is heavily modified and changed from the original source. And that is where we differed from everybody else. We went back to the source, try to keep the fish oil in its natural state.
So let's talk about that process in just a minute. I wanted to get a little bit of input from Dr. Silverman. One of the other big areas that I focus on in my practice is showing people who is heading for diabetes. We can actually predict diabetes 15, maybe 20 years ahead of time. And if I can tell you that you're on a path to diabetes and you would rather not become a diabetic, you have the power to prevent it. Most people don't realize that. So one of the strongest root causes of diabetes is the American way of eating. So the average American eats at least 4 to 5 times more processed carbohydrates, refined sugars, and wheat flour-based foods that drive our blood sugar up. And when our bodies only need a certain amount of that sugar, which is a carbohydrate, and we eat a lot more than that, we store it. And we store it as something called triglycerides in our fat cells, and they get bigger, and so we gain weight. Something else happens, though. There's a hormone imbalance that occurs where it drives a hormone up called insulin. And insulin is required to make that glucose or sugar go into the cell where we can use it for energy. But there becomes a vicious cycle. So if you eat more carbohydrates than your body needs, your body produces more insulin than it otherwise normally would. which makes the gateway into the cell called the insulin receptor become deaf to the message, which is part of the vicious cycle. So now your body has to make more insulin. And then you eat more carbohydrates, and the insulin message gets louder, and the cell gets deafer. And what happens then is you become a pre-diabetic. Diabetes is nothing more than a magnified condition of the pre-diabetic, which is insulin resistance. And so when we eat foods like the average breakfast cereal, or pancakes, or a bagel, or an English muffin, it doesn't taste sweet. But what we don't realize is that is being immediately absorbed as pure sugar in our blood, and it starts the vicious cycle. So Dr. Silverman's developed a high fiber, high protein, anti-inflammatory, neutral blood sugar effect breakfast drink that maybe you'd like to start talking a little bit more about, and how you came to develop this and the benefits of it.
By way of disclaimer, I am a patient of Dr. Lourie, so I have heard exactly what he said, and I took it to heart. And so for the past 6 years, I've been trying to use nutritional elements to modify this vicious cycle. And I think I have found a way to do it, and it's not difficult. And the food supplements are all natural, nothing exotic. But my first goal was how to develop a source of calories that had essentially a glycemic index of 0.
Now, a glycemic index, for those that are not familiar with that, would be how high does my blood sugar go after I eat that food? So for example, the glycemic index of a chicken breast, which is almost pure protein with some fat, is 0. The glycemic index of a baked potato is extremely high. It's about 85 or 90. And for reference, table sugar is a 70. So a potato releases more sugar into your bloodstream than table sugar.
That is surprising, isn't it?
Right.
Yeah.
So go ahead. So you developed a low or no glycemic index.
Exactly. Well, I work out every morning, and so I lent myself towards amino acids. And there are excellent sources of amino acids that are extremely bioavailable. The most commonly used one is whey isolate. And anyone can get it. People are using it all around the world and the country. So I started with that as a source of protein, and then I added casein, which is another whey milk kind of product, but it's a slow absorbing amino acid powder, and that was going to be the source of energy, because amino acids can be converted by the liver into glycogen and then be used for energy. You have to have energy. You have to have calories. Then I added to that fiber. Lots of fiber. Fiber, again, causes the energy in the protein to be absorbed more slowly. The fiber also has amazing benefits in terms of the health of the GI system. And also I added beta-glucan on the suggestion of my colleague, also an excellent source of soluble fiber, with a absolutely proven benefit on lipid profile. And
so it can lower your cholesterol.
Absolutely lower your cholesterol, and maybe beef up the high density and lower the small density particles.
So raise the good stuff and lower the bad stuff.
Yes, and 3 grams a day is all that's required. Where do I get my beta-glucan? I get it from Dr. Martinson. And that's in the breakfast drink. So the net result so far to date is that people taking it, and I have only a small group, maybe 15 people, they express a dramatic reduction in their hunger for up to 6 hours after taking this breakfast drink, which means that lunch becomes a social event, not an eating event. And we all know diabetes is linked to weight, and again, a cycle. If I can give you a way of ingesting a very healthy breakfast, and the net result is your second meal, lunch, is relatively small in caloric intake, you've already gone for maybe more than half the day with only having consumed maybe 800 calories and feeling very full.
That's probably a great topic for another series about intermittent fasting and the benefits of that. But you're essentially saying that your breakfast drink is almost like an intermittent fast because you haven't eaten since dinner. Your breakfast has zero effect on your blood sugar.
Yes.
It's fiber, protein, and other nutrients. And essentially lunch, which may be now lighter because you're full, becomes almost like the first meal of the day.
Yeah, and there also, in this breakfast drink, I've addressed inflammation. Although I certainly would not ever miss, on a personal level, my omega-3, which I take, Omega Cure actually, to be specific. But the lining of the intestinal tract is, as you mentioned in your introductory comments, is the wall between the outer world and the inner world. And in this, there's a new compound, relatively new concept. It's called resistant starch. Resistant starch is made from, in the case, what I use, it's potatoes. The resistant starch is a carbohydrate, a rich carbohydrate, which doesn't pass through the lining of the small intestines, does not give you a blip on your glycemic.
So it would have a glycemic index of maybe 0.
Maybe 0.
Okay.
But when it hits your large bowel, the flora, these are the millions and billions of bacteria that live within us and who serve a very valuable function. They love that. They make butyrate as a side product. Butyrate is an extremely important substance for the health of that mucous membrane, which again separates the inner world from the outer world and has, I think you would probably agree, a potential effect on these low-grade inflammations that we all suffer from.
Mm-hmm. So we see a lot of different protein bars, protein shakes. There are hundreds of them out there on the market. What I found when I look at most of those, and some of my patients ask me, which one would you recommend? There are very few because most of them are chock full of sugar.
That's correct.
And preservatives and binders and all sorts of things that have nothing to do with nutrition. So how did you avoid that?
I had to come up with something that you would like to have for breakfast.
Right, it has to taste good.
Yeah. So the basic idea is seeds, which are chia, flax, sunflower, psyllium. Those seeds, if you grind them up into a meal, they actually have a little bit of a nutty flavor. And I also use protein powder, which also comes, my favorite flavor is actually banana cream. And so you have the banana cream and the nutty flavor coming from the seeds, which enhances, which gives you a fairly pleasant flavor. One of the bugaboos in my formula is one of the components of the formula is matcha tea. Matcha tea. Matcha tea was put in there because everybody likes to have a little bit of a stimulation in the morning, usually with coffee. Matcha tea does the same thing without the jitters and has many, many, many health benefits in terms of free radical scavengers.
So it's an anti-inflammatory.
Absolutely. Powerful anti-inflammatory to go along with the fish oil.
But Dr. Silverman, what I think you did not answer, that Dr. Lourie asked about, is what is making this different from the other ones. And I think what is really making it different is that you are using less processing and is fresh.
Yes.
And that's the whole key, that if you want a long shelf life, it's only 2 ways to obtain a long shelf life. You add lots of additives or preservatives, or you take away all the nutrients. So the more you see these finished protein bars and nutrition bars in the stores lying in room temperature, long shelf life, you know they're going to be full of things that the body does not need.
So how do you store yours after you make it? Do you freeze it? Do you put it in the refrigerator?
It immediately goes into the freezer, immediately. In fact, I won't sell more than 2 bags at a time. And they are always to be kept in the freezer. And then when you run out, you call me, I get you some more. We're never going to sell it where you're going to have it sitting around on the shelf for a long period of time. That might be okay, but I'm not even interested in it.
So this is a powdered product?
It's a powder you mix with water.
And what do you call it? Did you give it a name?
Kickstart AM.
Okay.
for the time being, because I think that's going to be very hard to get a trademark on, but right now that's the
Now,
name.
sometimes you check your own blood sugar after meals to see if it rises, to see if you were eating the right choices. Have you ever tried that after your particular shape?
I've done it many, many, many times. Fasting, 1 hour and 2 hour.
And what do you see?
A variation of less than 10%.
That's great.
Not only that, I do have 15 or so people, many of whom you know, who are doing the same thing, and they have had exactly the same experience.
What about weight changes? Is it neutral? Do you gain weight or do you lose weight?
There is no question that you can, if you wish, lose weight, because you're not going to be hungry. Having told people if weight gain is their goal, you know, maybe leave the wheat out. I'm really anti-wheat. And leave out many of the white, sugary foods that we take for granted. And most people, and again, I have a group of 15, almost every one of them is experiencing painless, effortless weight loss.
Weight loss, okay. What do you think their average loss is? Have you gotten a feel for that?
I'm thinking maybe half a pound a week.
Half a pound a week, that's pretty good.
Yeah.
So tell us a little bit more. We're just going to get back into the differences in fish oils, just as we spoke about the differences between a freshly made protein and fiber and nutrient powder that you can mix with water and use for your breakfast versus all the different fish oils on the market. All you have to do is go to the drugstore and look, and there are a myriad of choices. How do you choose what makes one better than another? Can you tell by smelling it, for example?
That's a very good question. And we have exactly the same approach as Dr. Silverman. It has to be fresh. You would never buy old fish for dinner. Why would you think that taking a rancid fish oil and where you start burping fish after you're taking the fish oil, that is going to be good for you?
Right, if you take a fish that smells fishy and cook it, it still smells fishy, doesn't it?
You would never, and that may be one of the reasons why eating fresh fish is so much more beneficial than taking fish oil.
So the healthy oils have not broken down.
That's correct. And 95% of all the fish oils on the market are so rancid that they are not fit for human consumption. That has been done by government studies in Norway, South Africa, in Germany, and New Zealand. So what we did was to focus on the freshness, keeping the oil in its natural state. And it was a challenge in the sense that you have to start with the fishermen, how they collect the raw materials, making sure that it's not exposed to heat or to bright light, process it right away to get rid of mercury and pesticides, then lower the temperature dramatically and refreeze it when it's manufactured right after the caught or the catch in Norway. Then it's shipped frozen to Tampa Airport. We pick it up at the airport, we bottle it, and then send it directly out to the consumer. That is a very short time between the catch and a consumer getting the bottle. Think about the fish oil capsules or the liquid that you buy in the stores. It's about 2 or 3 years old and with an incredible rancidity. If you had the same rancidity of the fish, I guarantee you would never eat it. So how would you know if the fish oils on the market when you go into the store, if that is a good
I guess if you could smell it, but otherwise they're inside capsules, you may never know, right?
Yeah. It's probably that's the best way to do it, is to taste it. Our taste buds are very sensitive to discovering if it is rancid or fresh. If it tastes bad, it is bad. That's how simple it is. Fresh fish oil has no fishy taste or smell, and that is why we are able to put it in a bottle, or we have a pre-measured dose here. Take 1 per day, and we guarantee you that you will cover all your omega-3 needs. And it's so tasteless and pure that I can even use it for making chocolates or cookies. And
so most people probably find that hard to believe, that you could have a fish oil that does not taste like fish oil.
I could never use the regular fish oils on the market for doing that. But even when I call it cookies or chocolates, it's not candy or snacks. This is health foods where we are using non-processed ingredients or very low processed ingredients, no added sugar, no preservatives. We tell people keep it as cold as possible. And it's an approach. But what I think is important, what you are doing, Dr. Silverman, is with that incredible powder that people take, you start changing the flora, bacteria flora in the guts. And what we do know is that these bacteria will send signals up to the brain. And the more junk food you eat, the more selected these bacteria become. And they will send signals up to the brain saying, we want more of the bad stuff. So people will be craving more and more the things that they do not need.
And there's some recent research that it may be signaling and changing neurotransmitters that add to depression or produce depression, agitation, anxiety. So it's hard to believe, but the food that we eat, which is processed by the bacteria in your colon, can change the way you feel.
Yeah, and we know several of these ingredients are very selective in what kind of bacteria will really enjoy being in the guts afterwards. And that might be one of the reasons why the oat fiber, for example, may be lowering the risk of diabetes or helping that out.
Well, these are fascinating topics, and we have a lot more to talk about, both on the omega front and on the high protein, low glycemic index, high fiber front. How can people find out more about your products if they're interested in them?
Well, I really think this is the first step. I would like to see people join me and Dr. Martinson, and perhaps if you have the time, you're a busy practitioner, in a seminar where we'll sit around in a table. We will address any and all questions. And if you want to be on that list where we will notify you when that seminar is about to occur, just go to the email site on your screen, which is kickstarteram.2015@gmail.com, and we will let you know when the seminar is taking place. We love to have, I think I would personally love to have 15 more people in my beta group as proof of concept. We're working on proof of concept.
Great. And how about you, Dr.
Johnson? And people can always meet us at the Sarasota Farmers Market every Saturday morning, or they can come to our factory in Venice at Commerce Drive. But again, I'm looking forward to meeting individual users or people who are interested in small groups, because actually what we do is to educate. Preventive medicine is education.
Absolutely.
That's the only way we can change people's health.
Right, you empower people to understand why certain things are healthy, why certain things are harmful, and once they understand it, unless they like hurting themselves, they really do change.
Yeah, and the science behind it is kind of complicated, but we can make it easier by giving examples of how this is working.
Right. Well, I think these are great topics for future series on this health topic in general, and I think we can get much more into all the other conditions that this type of dietary habit will improve. Any other last comments you'd like to make?
You're a terrific moderator.
Thank you. Dr.
Well,
Martinson?
I didn't get much chance to talk about the different benefits of the omega-3, but I think today everybody agrees that we need to increase the consumption of omega-3 in this country dramatically. And what it takes to get all the benefits, you have to have a fresh oil, it has to be complete, and you have to take high enough dose every day. When you do that, you can feel the difference and you can measure the difference, and it will be the most valuable component if it is added to, for example, the powder that Dr. Silverman is making.
Great. Well, I thank you both for coming, and if anyone's interested, they can go to your website or your email site for more information. If you have any interest in my practice, heartattackpreventioncenter.com. Thank you very much for having us.